All right.
Donna?
Donna Kalame, Executive Director of the In-Home Supportive Services Public Authority in San Francisco. There is a study done by Candace Howes at the University of Connecticut that studied meaning San Francisco's public authority wage increase that's between 1998, where the wage at that point was $7, and 2003, where I've forgotten exactly where the wage went up to. It was around $10. But in addition, we worked with our county and were able to, through our public health system, to provide a specially designed HMO for home care workers there in the IHSS program. If they work 25 or more hours a month on a kind of continuous basis, for $3 a month, they can enroll in a comprehensive health plan and dental. And we did find then, it's the Dove factor, that yes, when you pay more wages and provide benefits, especially when the wage was enough above minimum wage plus the benefits, that retention and matching and turnover began to go down. I do have to say, though, very recently with Candace, she's done some further studies showing that matches are not necessarily staying at the same kind of lengthening, and I don't think she knows any particular explanation for that other than if we saw the chart earlier where even though wages went up, and at the moment in San Francisco they are $10.95 an hour take home, they're still not keeping pace with inflation and other things. So at some point, even though our wage is going up and the benefits are there, you still can't keep pace with other sectors. Also, just interestingly, in San Francisco, the Bay Area was mentioned, and Bay Area counties do tend to have, and some other scattered counties around California have a better and improved wage. But because our wage was above some other counties, our workforce of about, now it's about 14,000 workers serving 17,000 consumers just in San Francisco alone. And 10 to 12% of our workforce came from out of county. So people who lived elsewhere saw that that was a relatively attractive situation and came to us for work. And if they work in our county as an IHSS worker, they were eligible for the health plan. So,
well, very good. Peter?
I don't know how much translates from agency workers to consumer-directed workers, and Vera Salter's definitely an expert in this area. But in Better Jobs, Better Care, using some of the baseline data, my colleague Diane Brannon and I have done a paper that's coming out in the Gerontologist looking at factors that you could think of it as factors that push and factors that pull. And certainly compensation is one thing that is a pull, but it's not the only thing. Caring, the satisfaction of caring for people with disabilities is a big thing. And that is something that you can't deal with by improving the working conditions. That's more a recruiting factor. And on the push side, a better job alternatives for the individual is one big factor. And the other is supervision, bad supervision. The word is people don't leave their job, they leave their supervisor, and there's a certain element of that as well. I don't know how much of that translates.
Okay, thank you. Terrence, do we have any other questions, like from the webcast? Or okay, we'll take one other question, and then we'll get some final comment. Okay, but we'll start over here.
In answer to your question about retaining workers, my name is Greg Neal, and I'm with the Illinois-Iowa Center for Independent Living in Rock Island, Illinois. What we have is a training program where we pay the attendants to go through the training. It's a 5-day training. is pretty intensive. We recruit attendants by informing them about the independent living movement, independent living philosophy. We acquaint them with the ADA. We let them know that what they're doing is not just about money, but it's actually making a difference in a person's life. I'm not a statistician or anything of that nature. I'm an advocate. And what we do is we teach them how to advocate. We tell them to get involved in the political process because they are a part of that consumer's life. In working with a quad, they become a major part of their life because they do the things that that person cannot do. So it's very important that they understand what it is that they're doing and why they are doing it. We let them form support groups. We pair them up with people who have been in the attendant field for years. We have consumers who have had the same attendant for 10 years. I work with one lady, she's had this one attendant for 15 years. Wow. And they form relationships, and we let them foster those relationships by meeting at our agency, forming support groups, getting together, finding out what works for one person and what doesn't work for the other person. Our biggest issue is housing. It's one thing to get a person out of a nursing home, but if they can't get into the home that they want to go to, what good is it? We're looking at housing issues. Basically, we have created a housing directory of accessible housing. We have a directory of attendants, and we're finding now that not only are people who receive services through our agency contacting us, but we have hospitals contacting us wanting attendance for their mother, wanting attendance for a husband or a child. We network with the Autism Network. We network with and collaborate with the American Association of University Women. We work with other groups in our community, and by that way we get our face and we also get our purpose and our goals out there to the community.
Okay, thank you very much. Okay, we'll take one more over here.
Just a quick comment. My name is Carrie Blakeway. I work at the Lewin Group, but we also do some work for the Centers for Medicare and Medicaid Services to run a national direct service workforce resource center. And we partner with the Paraprofessional Healthcare Institute and actually Sue Flanagan with Westchester Consulting. And that resource center was funded really to help providers, employers, consumers directing their own care, workers, researchers, states, with questions about recruitment and retention. They can go to our website or call us, and the technical assistance is actually provided for free. So you can talk to somebody in the field about recruitment and retention issues if you're interested. It's online at www.dswresourcecenter.org.
Okay, well, I see Doug wants to make a comment, and then we'll take you.
Douglas again from New Mexico. I agree with what the gentleman just said. We at the Independent Living Center, I would say 80% of our consumers retain the same attendance they started off with in the beginning. And one of the things we do is we teach them a lot about the IL philosophy, the movement, and that empowers them as I see it. And also I've got one question, I believe was for Peter. My belief was that the consumer directed saved the state money. Like in New Mexico, we have a set monthly billing for each consumer, whereas the home health agency that our agency erected billed by the hour, so they're collecting more money from the state, from the department. Could you clarify that for me?
That wasn't the case in the cash and counseling consumer-directed care program, but the comparison was to what was spent in total in the consumer-directed care program versus what was spent in total in the traditional agency care. So it's a slightly different comparison that you're making, which is it's the total effect.
Okay, thank you, Peter. Okay, one last one.